Good morning, everybody. Assuming the chair for the election, and I'm calling the meeting to order. Roll call, please.
Good morning, Alan Barfoot,
Present.
Brian Milne,
Present.
Kevin Eccles,
Down report.
Sue Carlton. Present. Chris Peabody,
Present.
Luke Charbonneau,
Here.
Sue Patterson,
Present.
Helen Claire Tingling,
Morning, everyone.
Kenneth Craig,
Present.
Nick Saunders,
Here.
Chad Richards,
Thank you.
Beverly Wilkins, Beverly Wilkins, Beverly Wilkins. Thank you.
I will now open the floor for nomination to the board chair 2024.
I'd like to nominate Sue Carlton, please.
Is there anyone to second the motion? Mr. Eccles, sorry. Moved by Brian, second by Kevin. That Ms. Carlton be nominated as the chair of the board 2024. Are there any other nominations for chair? Helen there?
I nominate Mr. Eccles.
Is there a seconder for this motion? Nick Saunders. Moved by Helen Claire, seconded by Nick. Mr. Eccles is nominated. Are there any other nominations for chair? Are there any other nominations for chair? And third, are there any other nominations for chair? Can I have a motion to close nominations? Brian, sorry. Okay. So the nominations is closed. Miss Carlton, do you accept the nomination?
I will if Kevin doesn't want it. But I will, Kevin.
You just said you accepted it. That's good. That means that I can say whatever. At the same time, nominated and seconded, but at this time.
So Mr. Eccles declined the nomination. Ms. Carlton accepted the nomination and was acclaimed as board chair for 2024.
Okay. So next then would be item 2.2. Actually, first I should say thank you. I'm not sure I really need it, but I'll say thank you. And I will be relying on everyone for your support through this next year. So item 2.2, vice chair. Could I have a mover for, or nominations for the position of vice chair? Brian Milne?
I'll nominate Luke Charbonneau.
Is there a seconder? And Craig? Are there any other nominations?
Ms. Chair,
Yes, sorry, Helen Claire.
I nominate Mr. Peabody.
And is there a seconder for Mr. Peabody? Seeing none, are there any other nominations? Got to have 3 times for nominations.
I was told by the clerks to call me.
So that was the 3rd time. Mr. Charbonneau? Do you accept?
I will accept, Madam Chair.
Thank you. So I need a motion to close nominations for vice chair then. Mr. Eccles and Mr. Peabody. And so then we are moving on to the appointment of the executive committee, which then becomes chair, vice chair, and
Usually we call for.
Okay. okay, so the executive committee. Mr. Peabody.
I'd like to nominate Chad Richards.
There's a seconder for that. The chairman. Are there any other nominations for executive committee? Helen Claire,
I nominate Mr. Saunders.
is there a seconder for that? Mr. Eccles? Are there any other nominations for the executive committee? Okay, so apparently we're not limited to 3 on the executive committee. Do we have any idea how many? And sorry, I should ask first, do the chair and vice chair automatically sit on that? And so that would give us 2 more.
Right, so usually the chair, the vice chair, and a nominee, potential nominee usually, but the standards, sort of here in my, the Ontario standards in the requires multiple committees, and because we're a small health unit, we have a second committee to actually do all these functions. But we're not limited to one committee, we're not limited to a specific number. So if there are 3 or 4, it could be more, to look at whatever the business is.
Okay. Does it make sense to go 1 more on that then? So that we don't have a tie vote ever happening, or the potential for that? Mr. Kraft,
I would suggest that 4 is an appropriate number because the executive committee is speaking on behalf of this and you don't want 3 of 5. I would prefer 3 of 4. Agreeing with a particular action.
okay. Valid point. Any other comments from anyone else on that one? So we close nominations there, and Chad Richards and Nick Saunders, as well as the chair and vice chair, would become the executive committee. That procedure there. Okay, so I'll call for closing the nominations, and then we should have a motion in place that. Okay. Good. Close nominations.
We'll close nominations, and I would move that Nick Saunders and Chad Richards be appointed to the executive.
Okay, and could I have a seconder on that? I think I saw Mr. Bartlett's hand. Okay.
Yep.
So that's moved and seconded, and I will call the vote then. All in favor of that? Carried. Amendments to the agenda. I think Dr. Ary, you said you had one there.
I do have a couple sort of American for the in camera and under solicitor client privilege, and there's an item under correspondence for response to the board. And there is a note, not rather item, which is appointment of the auditor. We already have you appointed, so the policy requires election, chair, vice chair, executive committee, and appointment of the auditor. However, we already have this as a contract with BDO for this year. So just one.
So the auditor is already in place and does not need to be appointed at this time. Approval of the agenda then as amended.
Madam Chair, I have an additional item I'd like to add, please. It would be an update regarding my provincial appointment.
So we would add that where?
In correspondence.
Okay. Okay, thank you, Mr. Barfoot. Are there any other additions to the agenda? Seeing none, so then approval of the agenda as amended, could I have a mover and a seconder, please? Mr. Craig and Mr. Eccles. Is there any discussion? I will call the vote, all in favor. It's carried, thank you. Disclosure of pecuniary interest. That may be declared at any time throughout the meeting if one should arise. Item 6.1, the adoption of the minutes from Friday, November 24th, 2023. We have a mover and a seconder to put those on the floor. Luke and Helen Claire. Is there any discussion on those minutes? I will call the vote, all in favor. Carried. Moving on to correspondence and media releases. Item 7.1.1, letter from the Association of Local Public Health Agencies, Alpha to Chief Medical Officer of Health, Dr. Kieran Moore.
Madam Chair, I can summarize all of the responses.
Okay.
Sharing my screen for you. So, Madam Chair, we have seven correspondence with the two items added. One of them is the first one is this is the item that the communication from the Lieutenant Governor of Ontario. There is a new appointment to the board as stipulated by the it's about perhaps for the better respondents. Ms. Beverly on Sound has been appointed as a part-time member for a period of not exceeding 1 year. There is a renewal. The second communication is a renewal of Helen Claire's appointment for a period not exceeding 3 years, which is the maximum for the appointment usually. And for the recommendation to receive sorry, Madam Chair, I'm just gonna switch the screen to another document. So it's not moving with the way I want to. There is correspondence from Alpha, the Association of Local Public Health Agencies, to the Chief Medical Officer of Health, Harry Moore, and the letter Madam Chair, I'm gonna just again switch documents, so I thought I was switched this. All the correspondence summarized for myself. That's not the document, that's it. It was letter encourage engagement and dialogue with boards of health on the subject of mergers and strengthening public health, and the recommendation that we received. The number 4 is a letter from the board chair for Peter Road to officials in the province, including the Premier and the Minister of Health. And it's calling on proactive engagement in the sector to review Ontario public health standards and invest in health promotion and to reduce burden of chronic disease. The recommendation is to receive. The number 5 is respondents is the letter from the board of chair for student health units to the Premier and the Minister of Health. And there is a call to support the call from Sudbury Health Unit in public health strengthening and health promotion to invest more in promotion, similar to the one before. And the recommendation is to receive. The final letter is from Alpha to the Minister of Finance, and I do believe this is a key correspondence in the list where they're calling on an increase in, on average of 11.8% for the funding for health unit, which is able to deliver the services based on the Ontario health standards in short. And my recommendation is to endorse this communication. And I will turn it to Mr. Barfoot, so you mentioned there is another correspondence or taking questions.
And Mr. Barfoot.
Sorry, Madam Chair, sometimes I'm finding it hard to hear. Sometimes it blanks out sometimes on the sound. I don't know whether Helen Claire is hearing that or not as well, but sorry, what was the question?
So you added an item under correspondence, so we are at that point.
Oh, okay. A ministry staff called me regarding my reappointment to the board, and at that time I advised him that I was declining my reappointment to the board, so I will not be continuing to stay on. My current appointment goes to the end of February, so I will stay until that meeting. And I've also already received a correspondence from the ministry thanking me for my time on the board.
Okay, thank you. And I would think the board thanks you as well for your time served here. So are there any questions on any of the other items of correspondence from members of the board? That's correct.
Through you, Madam Chair, just a question to confirm. I could ask a question: what determines the length of time that a provincial appointee is established for? Our one member reestablished for 3 years, and the new appointee is a 1-year term. Could you forward me the distinction? Like, is that a member request or a ministry mandate, or what determines that, sir?
Through you, Madam Chair, the appointment is at the pleasure of the province or the lieutenant governor. The process itself is not something that I'm very familiar with, but my understanding historically in this health unit, the appointment will be renewed for 3 terms, and each term is 3 years. And there were a number of people who completed the 9 years. In 2019, when there was an announcement to merge or amalgamate health unit, many of these appointments were not renewed, and there was a pause on the on new appointments. And that changed after the pandemic. We are seeing a number of new appointments, and sometimes it is 1 year, and sometimes it's 3 years. The decision is made internally and at the level of the province. I'm not familiar, like I'm not in a position to speak about it or have the knowledge to actually point it out.
Thank you.
Any other questions, Mr. Eccles?
Through you to, I think more to the board on this one is the wording in that the appointment of the provincial appointee is part-time. Right? Well, it's like, you know, you're on the board. Is it just part-time, or what makes up part-time? Just the language that they're using in that is strange, because I thought that, you know, all of our provincial appointees are, you know, they're on the board, they're participating full-time on the board, but just it's a quirk. That's a little nuance that I have. The other one is in number 6. I get lost sometimes in the numbers. Healthy Babies and Healthy Children program will need 132 million, which would be 11.8% increase across the boards. The Healthy Children program in 2023 required 12.5 million, which is a 13.8% increase. Am I missing in those numbers, or how do I read that?
Madam Chair, through you, this is excluding the Healthy Baby, Healthy Children. That comes from the Ministry of Child Services, versus the rest of the budget. The main budget for Health Unit comes from the Ministry of Health. And my understanding, the 132 million is the total funding in 2023. So perhaps the summary here, we can go to the actual letter and basically they're looking at the funding for each health unit and seeing how much more we need funding to reach our standards. And the total number for all health units is 132 million, which is the number itself. If you put it beside the budget of the healthcare system, it's less than 3%. Usually it's between 2 to 3% funding for public health versus 98% funding for the healthcare system, hospital. And so it's a drop in the bucket, more or less. And in my opinion, and obviously I have bias towards public health, any dollar you invest into public health is going to prevent dollars to be invested in the healthcare system. Yeah.
Sorry.
Well, I just follow up on Kevin's questions. I just wanted to say that I support Dr. Ary's recommendation to endorse this letter from Alpha. I think, this comment, and it is positive, where it states in the letter, the $47 million in annual base funding that has been restored with a guaranteed increase of 1%. This is a positive move, but it isn't enough. Because we're bringing this to 2019 levels in the year 2024 is, considering the inflation we've experienced, not to mention a pandemic that occurred in the intervening years, and, whole different sorts of paradigm, necessary to get to an appropriate level of funding. And what this means when we are essentially frozen at 5-year-old numbers is that the quality of service of the health unit can provide will decline relative to where we were in 2019, and also relative to the expectations of the public and relative to the best interests of the community in terms of the health of our communities. So I do strongly support this letter, and Chair, if a resolution is necessary at this point to support that letter, I'd certainly be willing to make that motion. Thank you, Madam Chair.
Madam Chair, I'm also supportive of the recommendation to endorse the letter. Just a quick question on the process. What does an endorsement of correspondence look like after the meeting? Does that mean a follow-up letter is sent from the health unit to the province, or what does that look like as a next step?
I will turn to you, Dr. Ary.
Thank you, Madam Chair. That's exactly the endorsement. It's a formal letter from the board to be sent to the province, to be CC'd to all Board of Health, the Alpha, and related stakeholders, whether it's local MPPs or whomever the respondents reaches to.
Okay, so we have a mover and a seconder for that motion. Is there any further discussion on that? Ellen Claire? You're muted.
Thank you, Madam Chair. If I may, through you, just respond to my colleague, Mr. Eccles' comments with regard to provincial appointees, just for, because we are public and I wouldn't want anyone in the community to get the wrong impression. The part-time, of course, provincial appointees, there are a number of agencies, I don't know how many, and some are actually full-time. That refers to how many days of hours in the day, or rather how many hours in the week. Under, I believe, labor law, more than 30 hours a week is deemed to be full-time, less than is deemed to be part-time. And I just want to add, for myself as a provincial appointee, this is my 3rd term, and I have been on the executive up until now, and I have never missed a meeting, an executive meeting or a board meeting. So I absolutely, as a provincial appointee, take the position very seriously. And that, of course, includes additional time behind the scenes spent looking at documents or speaking on issues, telephone calls, and so on and so forth. So just for anyone listening in the public sphere that might be interested in applying to the board, they certainly can go on the agency's board and commission's website and apply and follow the process for consideration. And the part-time designation for this is based on that the meetings are once a month, generally for this board, so it's not a full-time position. Thank you, Madam Chair.
Thank you for that clarification. So we actually have a motion on the floor that we need to vote on, which is to provide support to item number 6 in the agenda and send a letter. Is there any, Mr. Miller?
So will the motion not indicate it's going to receive and endorse the various? Is that typically what we do? I believe. Correct. Rather than just the one, unless there's a change. But
Okay, so we go back.
to receive the various and endorse the various as recommended.
Thank you for that. So we did not have a motion on the floor for that specific, so
It's,
the mover and seconder are willing to let theirs stand for the full.
yeah,
Is there any further discussion or comment then? I will call the vote, all in favor. And that is carried. So we are moving on to media releases. And I see Denny on there. Welcome.
Thank you, Madam Chair, and through you, there are 7 media releases on today's agenda. Earlier this month, a media release was issued to advise the public of a surge in influenza A cases, both in Grey Bruce and provincially. Public Health is reminding people that it's not too late to get this season's influenza vaccine, which is the best defense against severe complications from the flu. With November being Fall Prevention Month, Public Health issued a release early in the month to shine a light on the prevalence and potential health impacts of falls across the lifespan. The release also included strategies and tips for preventing falls. Also in today's agenda package are media releases about animal exposure incidents, a release about modified holiday hours for the well water testing program, and a partnership with local police services to distribute overdose prevention and response information to motorists during festive ride stops. And finally, in late November, Public Health issued a media release to share the results of the Attacking Medication Misuse campaign. For this campaign, Public Health teamed up with the Owen Sound Attack and a local pharmacy, which provided people who returned expired and unused medications with vouchers for 2 free attack tickets. The campaign began November 18th, and within just 3 days, all 75 vouchers had been claimed, and in exchange, more than 120 bottles of unused medications were collected. And that concludes the media release summary.
Thank you. Does anyone on the board have any questions or comments? The question, Dr. Eric, we need a mover and a seconder to accept that report. Okay. So could I have a mover and a seconder? Sue Patterson? Mr. Saunders? Any further discussion? Seeing none, I will call the vote. All in favor? Is carried. Next item is medical officer of health update. So I'll turn it back to you.
Thank you, Madam Chair. So the first item is with delegated to Dr. Zayed looking for the open situation in Grey Bruce.
This report includes 1-year review for the opioid and substance use. I will touch on the SOS team, supported outreach services, overdose and mortality in last year, harm reduction and addiction medicine activities, substance use preventive initiative. So with regard to supported outreach services, last year we started that in 2022, and we strongly worked on SOS team and built a very good dashboard to monitor and evaluate the services. One of the most important here is to find the demographics across the services served for age group and gender. Another slide showing here the returning and new patients. So that's a very important thing that shows the trust built, and this also an important aspect in terms of how we work with the returning patients for a better follow-up and better outcomes. And again, I want to mention also that among the clients of SOS, there has been no opioid overdose incidents. This is regarding the site services. So this is, we started this as just providing a small service in 2 sites in Owen Sound and Hanover, and now we expanded that, and even the content or the quality of service have been expanded, showing more of a wraparound service. So the service including addiction medicine, connecting, assessment, case management, primary care. So that's the health side of it. On the other intervention, we have also opioid treatment, testing, and treatment care. And this is also will be expanded for 2024. This is the type of drugs or substances that were used, and we see here crystal meth and the fentanyl are the main drugs. These are here showing basic needs. So this service, as I mentioned, is a wraparound service. So it includes also service related to like social service, food and clothing, and other basic needs. This is referral, so we also document referral to certain other sources. So there is social referral, either to get work or house, addiction medicine for treatment, primary care, and public health. So that's the first item. For the second item is regarding the overdose and mortality for this year. So this is the total of overdose for 2023, and we divided by quarters so that we see which quarter are like higher. And it is good to see that there is a trend of decrease in overdose over the year, and usually high dose during the Christmas time. So it's good that it really hasn't been the case for this year. This is a mortality local reporting. So we have 2 kinds of mortality reporting. Local reporting that is reported through our partners locally for EMS and police, and there is more provincial by house unit reporting, including other cases that has not been addressed by EMS. So that could be emergency or hospitals or other setting. So that is the coroner data for mortality. We are still having high mortality, and there are many factors for that. Like it is relatively lower than 2021, but it is not lower than 2022. So we are almost similar, and that also gave us also a reflection of this year, what we can do more. And I will talk about that also. This is a suspected related death as a setting. So we can see here the increase in deaths out in homeless situation in 2023, and we always have strategic alignment meeting with the counties so that we can discuss this result, and this has not been the case in 2022. For harm reduction and addiction medicine, and this is something that we, given that there is the mortality is now kind of stable and not reducing. So we need to do more on that. Some of the things that have been done is supporting internal here in the public health. We have more training offered for naloxone and saving life. 65 staff have been trained in all programs. Bruce Ray Child and Family Services onboarded, and this is very important aspect of that. Overdose response and naloxone training provided to Georgian College staff. So we include more partners in that. Screening a movie to actually this movie was sort of like showing how the situation is and for fentanyl, and this was not for like it's mainly for the providers awareness, because we still need to engage and onboard more staff or more healthcare provider on that, and that includes also the family health team. Routine monthly outreach coverage for public health coverage in SOS and Chesley and Newash. Initiative to provide naloxone training and distribution to long-term care facilities and retirement home. And this is actually stemming from how sometimes we have sort of some treatment in health in the long-term care facilities, and this is part of our opioid stewardship that I talked about before in my preventive report. So also expanding that to long-term care facilities as training for their staff and awareness. Initiative also to work with partnership with primary care in addiction medicine to evaluate, plan, and provide addiction medicine approaches to treatment and supply. And this is, we haven't been in Grey Goose involving many of the primary care, and we started that last month to involve more of the primary care providers to understand concepts of addiction medicine, and we find that the best way also is to provide CME credits that is required for all physicians and nursing practitioners to maintain their certificate. So we are starting that in 2024 to have more focus on addiction medicine. Substance use addiction program funding application. So based on our data that I provided for SOS, we applied for funding for 2024 to have more staff as nursing practitioners. They have been proved very efficient in the work as outreach. The other thing is to have drug checking service in the across the Grey Goose here, so that it can help people who use drugs and help reduce the fatality and the overdose. For substance use prevention initiatives, so in 2023 we had started this project, the LDCT project, local driven community project for substance use prevention, and this is a main focus of prevention. So what is happening this year as an implementation at the local level of Grey Goose, we have more matrix management structure for mental health and substance use prevention, and focusing on youth, integrating healthy baby, healthy children, and healthy growth and development. Invest in this part through the evidence-based project that have been studied through that project. Actually only yesterday also I was approached by healthy growth and development and healthy baby work group at the provincial level, so that this part also, or our project would be part of the new standard in these programs, not only for opioid and substance use prevention. So that was a really good good implementation at the provincial level. Integrated schoolhouse program. So after, since that project was also focusing on youth, so we had an agreement with school boards to have more preventive intervention, intervention practices to the public health with the agreement with the school boards. With regard to all health promotion, and that will include evidence-based intervention for addiction or opioid-related programs. Ontario Public Health Standards and Protocol Review for 2024. Currently, I'm reviewing with other colleagues the protocols that will be based on, will be the base for the standards coming April. Focus on also prevention part in alcohol and drug strategy. So the alcohol and drug strategy has been have some sort of committee or platform for all community settings in the Grey Goose. So it is important also to focus and to give more focus on, in addition to emergency response, to the prevention side of the crisis. Opioid stewardship program in hospital and primary care, and I explained that in my previous explanation about the expansion of naloxone and also the opioid stewardship, working with primary care on more education, what is called academic detailing. It's the same as we use in antibiotic resistance, so that there is more awareness about prescription of antibiotics. Same thing is for opioid containing medicines. And that concludes my update. Thank you.
Thank you, Dr. Zayed. Are there any questions from anyone?
So I have a comment to make with regards to Hannaford SOS, Supportive Outreach Service. I had the opportunity to visit that Wednesday afternoon when it's held in Hannaford, and I want to thank and commend the different groups that are part of that. The service they are providing is so important to people who actually need it. And there's public health, there's EMS, Bright Shores, Great Housing, and United Way. And these individuals are compassionate, knowledgeable, and very helpful to these people. And it's, I just want to say thank you to those groups that are helping people.
Thank you. I have one comment. The also documenting the data and what service and how it is done is very important to continue this service in a consistent and improved way.
To you, Madam Chair. Thank you for the report. There's, for me, almost too much information, but that's a good thing. That's a good thing. That's a good thing.
It's not a surprise.
No, it's not a surprise, but I'm reading it. So I'm particularly interested in the SOS site services. 10,000 people served, I believe that's what the number says there, 9,500 over 2 years is a significant survey amount. So you get accurate counts. And the question that comes to my mind, you know, there are certain aspects of this care that falls within our jurisdiction and some that don't. And you know, I appreciate the cooperative nature of it. But more importantly is, does our board need to consider, you know, a reallocation of funds within our public health budget? Like if this is, I know that all the programs are important, but don't get me wrong. But if this is the epidemic, if this is the crisis, if this is, you know, the thing that is rearing its ugly head at this time, is it worthy of our board to consider saying, okay, well, you know, this one is maintaining, but this one is like, we need to reallocate some of our our budgetary numbers to put more emphasis on this one. So that's, that's we can just send a letter to the ministry, but maybe there's work within our own budget that we have to do. I'm not asking for a question. It might be a staff report at budget time or something like that, but we think about that. You don't need to answer that.
No, I have to answer that. Of course, through you, the allocation of resources is purely a strategic implementation issue, and we are doing that at the operation table of strategic implementation. That's why we have matrix management structure where we can involve many programs together. And instead of duplication of the work, we have some sort of matrix where we can involve the many, more than one program. Health promotion, communication, population health data, having one goal at the end for a timeline, finish with that and go to another thing. So that we are doing that internally in a good way. The other thing is through the not jurisdiction or other function, like the alcohol and drug strategy. So when we find that we need some budget about something like drug checking, I propose that there is a drug checking in Toronto. We can use this service, but they have faced some issues. So we have different venues. Like, for example, going to academia and partnering with them. There is another is the federal funding. So that's what we did in applying for federal funding for certain some things that we find that we need money for. So there are always ways, but when we come to have this thing like allocation through sending to the ministry, it will be another way. But currently we are doing well.
Thank you. Emily.
My question comes on the rainbow chart or whatever it was, the drug of choice. I guess the surprise was, you said that it was fentanyl and meth are at the top. But for a number of years here in Grey Bruce, it's always been alcohol. So to the point where I'm reading this, that alcohol is no longer a problem, or it's not the drug of choice anymore, or, it was just surprising to me that it was down that low. Or is there other areas where alcohol is an addictive problem? And I'm going to make the assumption it still is probably an addictive problem in Grey and Bruce. That there's other venues that people are getting help and resources.
This is a sample, not a sample. This shows people who are going to SOS.
Yeah.
So that's we can say it's a biased sample. It doesn't represent the community. There are other groups who are working on alcohol. Correct. But I would say that the binging problem in our community is less. There is other group who's working on injuries, drink and driving and all this. But in this particular group, this is the lens on the people who use drugs. So with them, their choice is meth and fentanyl. Why? It's cheap, it's easy, accessible. If a person really need to numb the pain, numb the visage, like this is the best thing. So unfortunately.
Glad you put that unfortunately. I can't think that,
This is qualitative, this is the analysis of people, why they use it. Because we need to know why they use it as well, to help them either get rid of it or have some better way of harm reduction.
Okay, thank you. Thank you.
Thank you for that. I had a similar thought and question on that, but it focused on just who's reaching out for the SOS program, not the full community.
Thank you, Madam Chair. I just, thanks for this report. It's a good report as always. I wonder, are you concerned at all about linking healthy babies, healthy children, and healthy growth and development with the opioid, with our opioid efforts? The only reason I ask is I suspect folks who might engage with healthy babies and healthy children would be worried about being assessed for their opioid use, and that may make them nervous about engaging with healthy babies, healthy children at all. I think we want to have certain outcomes with their children. And I would think we don't want to put up barriers that might say, oh, if I engage with this, then they're going to ask a bunch of questions about my drug use or other things, and that might get me into trouble.
Yeah.
Right. And I might, end up talking to police, or and I'm sure it occurs to many people, I might lose my children. Right. And so, well, I know you don't want to put up those kind of barriers, and I just wonder, how do we manage that? Is it something we're worried about, and how are we addressing that to make sure that we are not putting up barriers to people using healthy babies and healthy children, which is a really important program?
Through you, Mr. Chair, again, this is a great question, and this was actually concern raised by the team here. So it is important to make it like it will not be from the checklist. It is just how they build the trust with families and identify families who are using, like this is coming from actually very experienced nurses who are running this program. So they build the trust, they know people, and if there is during their screening, it doesn't have to be something like documented, but we need to have this rapport. The same as people going to SOS, like you can see the returning patients or returning clients are increasing. So this would be a way of how to help this, how to help increase the positive childhood experiences. So focusing on positive childhood experience in a context of a family or parents using drugs. So minimizing the exposure. And there are many other risks, like domestic violence and things like that. They are really experienced to deal with these issues. And I hope like it's again an introduction of certain things, and there is evidence-based program that really show that we studies that showed how to do that without bearing in consideration this kind of barriers.
Thank you.
Go ahead, John.
Through you, Madam Chair, two quick questions about the SOS services network. So the back of that drug of choice slide, does the data reflect instances where there are more than one drug present? Like I'm wondering, is that a total count, or does somebody presenting with, for instance, alcohol and cocaine, do they double count in that data? And also it looks, just kind of come back to Mary's points, looks like when it comes to resource allocation, looks like the first 5 to 6 months of the year are seemingly where we see the most instances or most level of support needed. So perhaps if we're doing kind of strategic resource allocation, those first 6 months of the year seem to be where we need the most support. So perhaps.
So my answer for question, there is no duplication in the drugs. So if someone, this is only the person who used the main drug, the main thing. So if they are using only alcohol, this would be the alcohol. In terms of allocation, it's not that they increase the allocation of service. It's really probably seasonal, and it's something that requires further study. But the service is like even all the year.
Okay, any further questions? I cannot see Helen Claire there.
I'm here, just
Okay.
preserving my internet.
Okay, that's fine. I just wanted to be sure that I wasn't missing you if you had a question or comment.
Thank you so much.
Okay, any other? Okay, seeing that, excellent report. Thank you very much. We don't have mover and seconder today, like this. For the shift information.
There are two other
Yeah.
items that
Yep.
motion for all of them. So the second sub-item, Madam Chair, is good news. It is related to Prevention Medicine 2024 Symposium, which is a major symposium in public health that is held by the American College of Preventive Medicine, and strategically they decided to host it in DC, in the capital in the United States this year. We submitted the hockey mass vaccination as a presentation, as an innovation in public health, and we received acceptance for the presentation on it. So that's going to be in April, and there's a process for it, but it's good news to share with all groups, because that's the initiative itself for mass immunization was collective effort from everybody around the table, whether it's the municipalities offering the arena, the police supporting traffic in the arteries in the town where we held the clinics, and other partners. So that's just an update for information. The last item on sub-item is on strengthening public health. The initiative from the ministry to do two things, mainly to encourage voluntary mergers and to find savings with the limited budget that we have, limited increase of 1%. So on the limited budget, there has been a number of health units that announced restructuring in the Southwest and across the province, and the restructuring entailed layoffs in some occasions around 10% of their staff. It wasn't easy on many of these organizations. We have a plan that we have refined over the past few months. It's going to be way less intrusive, and we will share the details to the board in camera. But in general, we followed the principles of the key strategies of minimizing job loss, investing in program areas that have the most impact, and disinvesting in areas that have the least impact, and maximize savings in the back office compared relative to the operation, and that's a ministry direction or recommendation. And the underlying principle is to retain as many staff as possible until we get clear direction from the ministry on the new standards that are being reviewed. And some of the tactics we used, it's from the textbook, whether it's finding efficiency, saving without changing service level, freeze discretionary spending, whether it's travel, work, shops, expenses. And those are not new. We have been doing this over the past years with finding efficiencies. Holding on non-essential new capital projects or program spending, or there are a number of innovative projects that can be put on a back burner until we know our budget. Human resources, we have hiring freeze to maintain gapping, whether it is maternity leave or resignation. We have not been filling this, and we have been preparing for this even during the pandemic. We hire people on contract versus permanent, so that's just easier to manage the expectations and the programs and the changes in funding in the future. Limit overtime, voluntary leave of absence. We explored all the avenues that we can, and I do believe we are in way relative better standing than the organization that laid off 10%. So that's on the front of the savings. On the front of merger, there has been two health units in the Southwest, Lambton and Chatham-Kent, that started discussions, and that's in the news as well, about the merger. And there will be funding for any organizations that go down the road of voluntary merger. There are sections that would provide more information. One of them is from the Ministry of Health, Lessons Learned Speaker Series. There was a session in 2023, and there is a session coming February 15th. I would recommend that as many of us can attend that to be plus for the board to get that perspective.
I believe the first session was attended only by Helen Clear. The Alpha Symposium is another avenue, which will be in February 14th to 16th. And there will be a workshop and sessions on the subject as well. I'll stop there, Madam Chair, open to questions on the update. That's all this.
Helen Claire?
Yes, Madam Chair, through you, just with regard to 8.2, it really is a feather in our cap here for the health unit and for Grey Bruce that the Hockey Hub mass vaccination has been so well received, even internationally during the pandemic. But Dr. Ara has been very humble in his presentation, and I wanted to just acknowledge again that this idea was his. It was a germ of an idea that he had, and he brought it to fruition. So we're really very lucky to have such creative leadership through the pandemic. And I just wanted to make sure all of us around the table were aware that it was his initiative. Thank you, Madam Chair.
Thank you for those comments. Ken?
Thank you, Madam Chair. In regards to this presentation, what's the funding stream for that? Like, do we pay? Does the ministry pay? Do the inviters pay? Where does, like, it's not like somebody be going, like, it's not a massive expense, but I just wondered, are we asked to pay for the presentation, or do we receive additional funding to support the board while someone goes to present it?
So, Madam Chair, the policies or the expenses for such initiative are not necessary on the health unit. Anytime there is training in the province, that's usually within the budget of the MOH. There is a certain amount allocated. Anything that's related to travel internationally or something that can be outside of the norm, it will usually come to the board as a request for funding or not. Yep. And it could be covered by multiple organizations, whether it is organizations related to physicians or Royal College. It could be depending on the grant that is applied to. So at this point, there is no request from the board for this. But it could be if.
I just wondered if that would be part of a report, or whether there's a resolution from the board to support this worthy thing. Like, I'm not opposed to it. It's just one of those little things.
Yeah.
Okay. Thank you.
Yeah, thank you, Madam Chair. And just a note, I did attend the webinar on voluntary mergers on the 13th of December, I think it was, and very interesting. And I asked the question in the webinar whether if you didn't pursue a voluntary merger, if you would end up experiencing a mandatory merger sometime down the road. And of course, the staff weren't aware of that. Weren't committing. I said they didn't know. I certainly didn't say it was off the table. So I just wonder, the doctor, I guess, what are we doing here to, and you'll forgive me, some of this conversation started before I was here. I don't know if we have if the board has a particular position on voluntary mergers at this point. Have we rejected that notion? Or are we still in the business of considering it? And if we're in the business of considering it, what steps are we taking to consider it? I think we should have a position on it if we don't already, because it's a matter, I think, of pretty significant importance going forward. And like I said, if we don't engage in it now, we may have to engage in it unwillingly later on. So that's my question. Thank you.
So, Madam Chair, that's from actually the entire initiative has started in August. This is not all business. Everybody around the table, I think, except for Chair, has been for that update in September and October, more updates. And indeed, there is a clear communication, at least verbally, that it's voluntary until 2 years from now. After that, health units who did not voluntarily explore merger or seek it, they will be told to merge. So that this is a clear communication was updated to the board as well. And the discussion at the board in September was to receive more information from the ministry and explore avenues for merger, including these sessions about the merger and what that means. And anything that has been coming to management from the ministry has been shared with the board. And it is a governance decision, more or less. It is the board. I remember in 2019, our board was probably number one in leading that initiative, where many health units were starting to resist it or to think about it. We were already in the action after planning. So we were leading in that in 2019, but that's a different initiative from this one. This one, we are receiving information, and I would strongly support what Luke mentioned, is to be active and proactive in this, whether it's through the executive committee or the entire board.
Follow up on that. If you have, Dr. some correspondence from the ministry that says that they will, after 2 years, require the literature, I'd like to see it. That was not what they said on the webinar. They said essentially that it was open-ended, voluntary for now, but would not say that it was going to be mandatory. And I think it's just Roma, there was some conversation about it too, and I didn't hear that from the ministry folks, maybe others did, that there was going to be a mandatory or a requirement to merge. So if that's something that you have heard from the ministry, then we encourage you to share that with us, because that would really, I think, put a very different complexion on how we're going to approach this in the next short while. Thank you, Madam Chair.
Madam Chair, the clearest communication about this was brought to the board with from Sue Patterson from the meeting with the chief OH, I believe in September or around that time, where the term that was used was voluntoured. It is in the board meeting. It's recorded, so it's something that. And the sessions from the chief OH, I believe, is recorded. We didn't receive it in writing, as I mentioned, but it is very clear that the health units are invited to participate in changing the standards over the coming year, to be given the opportunity to volunteer. And after that, the system will rearrange itself in the best way for the system. And obviously, from the Health Protection Promotion Act, the ministry has, the province has the authority and to restructure health units.
Helen Claire, go ahead.
Thank you, Madam Chair. Through you, I'd be very happy to share my notes from that 12th of December 2023 meeting, if that's useful at this time, and if it would probably take 5 minutes, and if that's not appropriate at this time, Madam Chair, I will echo my colleague Luke's comments. Since this first came out, and Sue and I did attend the thing last fall, there has been a lot of impetus, and I continue to suggest that a subcommittee be formed. And indeed, on this public health presentation, they talked about an amalgamation steering committee. And the importance of having such a thing. We're letting months go by right now where we're not taking a stand. And I am concerned that if we haven't researched it and come to decision making as a board, that we're not going to be in a strong position to speak with the ministry about what's best for our catchment area. So whether that is going to be part of what the new executive does, or whether it would benefit the board to have an amalgamation steering committee just to deal with this issue, is of course a board decision. Thank you, Madam Chair.
Thank you. And you mentioned having notes that you could share.
Absolutely. I'd be very happy to go through them right now, if that's useful.
Would it be possible to share those in writing with the rest of the board, and we can all read it and then bring it back for further discussion next month?
I've just been appointed to a tribunal and I just don't have, unfortunately, the time to take my scrap notes and form a document. But I will tell you that this is recorded, and if members would like to themselves go and look at the recorded presentation, I highly recommend. Thank you.
And thank you for that. Chris?
What, anybody heard of what the actual cash incentives would be? One of the mayors on the Wardens Caucus was bragging about the enormous cash incentives she was going to get for her leadership on a merger. I won't say which one, but she didn't say how much. Any idea how much is on the table?
No, 380 plus tax. I have no idea. I never heard that.
No, I sat in the Roma, well, the question part of the Roma session as well as the session back in December, and I don't remember hearing a number attributed. They're saying there's cash incentives, but they're not putting dollar values with it.
No, those who are getting it aren't revealing it either, so. Anyway, I think on that note, I think given the fact that it could be mandatory in a few years, we don't know. And if it was mandatory, we may not get those cash incentives. We definitely should set up a working group or something to the effect that Montclair stated to look at our options.
Okay.
You want to just
Go ahead, let's.
just go over an idea, Madam Chair, if the board wish to direct the executive committee to look at it in more detail at this point and come back to the board with some recommendations on the path forward. That might be an approach.
Okay. Any other comments on that? Seeing head nodding, so.
If that was a motion, I would second it.
Okay.
It can be, or that's, can be, sure.
So the motion would be to direct the executive committee to,
Bring recommendations back to the board regarding voluntary mergers in our path forward.
okay,
Timeframe,
we have a
it's next
motion.
month too soon? It's next month too soon?
Let's make it 2 weeks in a special meeting.
What are you doing next Friday? No, I'm serious, because
Yeah,
we all have lives and things to do, and Dr. Eric perhaps needs to connect with colleagues and gather information. There's a whole bunch of issues here. I'd rather give you time and it'd be well done rather than try and scurry through it. Or you can give us an initial report next month with a final report in 2 months, whatever, however you want to. And report back next month with their initial findings.
so there is another session, I missed the date, on, it's February,
February 15th, Madam Chair, there is Lessons Learned Speaker Series.
Right.
That's from the ministry. And the second one is the Alpha Symposium Section Meetings and Workshop, February 14th to 16th. So they overlap, but obviously there are multiple sessions in them. There are multiple meetings with colleagues on which is like Ken rightly said, we have a meeting actually later today, a number of ONWHs who are have interest in the merger or have been dealing with the merger or their board directed them to do. And, you know, the direction has always been to get more information. So I'm attending that. There are sessions through Alpha and Coma as well. But and there is a session for the Southwest. We meet frequently every month, sometimes twice a month, depending on the business. So there are, you know, as much information as possible. I will be eager to bring forward information.
okay, so I'm looking at the other members of the executive committee. Does a month seem reasonable or would 2 months be better?
I think the board, through you, Madam Chair, I think the board could count on the executive committee to move with all deliberate speed. I don't know if we necessarily get a timeline. We'll advance it.
Okay, so we have a motion on the floor. Can I call the vote on that then? All in favor? That is carried. Thank you. Okay. So then we still have to receive all of this information. all of these reports for information. Okay, so the medical officer update, could I have a mover and seconder to receive? Kevin and Chad, all in favor? That is carried. Okay, corporate services financial report. Kim.
Through you, Madam Chair, these are the November financials. So as of November 30th, we were in a deficit of $220,000. Our mandatory program funding was covering $378,000 of our COVID costs, and an additional $135,000 in COVID extraordinary funding was required to fully cover the remaining expenses. The seniors dental program deficit stayed around the same level at $280,000. We submitted a third quarter request to get additional funding for that. We had a follow-up request on February 4th of this year, confirming the amount that we needed, but we still haven't received confirmation back yet as to whether that's been approved or how much that we're going to receive for that funding. The Healthy Babies, Healthy Children, and Children's Oral Health Initiative have a surplus of $29,000. Those programs run until March 31st, 2024, so there's still time to utilize those funds. From a bigger picture standpoint, at year end, we haven't formally gotten approval for our COVID funding or our seniors dental, but if the seniors dental deficit isn't approved, we would still be able to cover that cost with our mandatory and then request the COVID funding to cover the cost for the year. So as long as the ministry comes through with their commitment to fund the COVID costs for 2023, financially we'll be covered for that fiscal year. For 2023, our revenues are under budget. We didn't require as much COVID funding as we originally thought we would, and we also requested a 2.5% increase from the ministry, but they approved a 1%, so we're under budget there. We offset that by underspending in our salaries and wages. So as contracts ended, we didn't bill them. Our occupancy costs were in line with budget, and for operating expenses, it was mostly routine purchases. We did renew some software licenses and purchase some tablets in November, which is why that expense line's a bit higher. For the Walkerton capital project, so we hosted the construction RFP on bids and tenders on December 20th. We had a site walkthrough on January 10th, where we had a lot more attendees at this walkthrough, which was promising. And the deadline is February 6th for the quotes to come in, and hopefully we can award a contract shortly after that date.
Thank you. Any comments or questions? Okay, seeing none, we need a motion to accept the financial report then. Chris and Luke, are there any further discussion? Seeing none, I will call the vote. All in favor? That is carried. So next is other business, 10.1, biannual review of board policies for policy number 1-100.
So, Madam Chair, this item is related to regular business related to review of all board policy. We're required to do this every 2 years according to the public health standards. And the last time we did this was November of 2021. And it's obviously due, but the December meeting was canceled as for the conflict in schedules. So I would recommend to the board to start the process as soon as we can. Usually it takes 1 or 2 meetings. The executive committee would usually review the policies and make recommendations that would come to the board for approval or addition. And in 2021, I do believe the process of reviewing was robust, that every clause was reviewed in these policies. So this round, it would be just updating whatever we believe would improve the business of the board going forward.
Okay, so that policy would be included, say, in next month's agenda or out to the executive committee to look at it first before that meeting?
The process, Madam Chair, that we used last time was that executive committee would look at all policies and make recommended changes, then bring it back to the board for review and approval.
So do we need a motion to that effect, or that's just the standard procedure and we move ahead with that?
We just need the committee to be willing to, or the board to direct the committee to do that. I don't believe we used a motion last time, but I could be wrong on this.
So if the executive committee is okay with that, we're just adding that to our list of things to do. Okay.
So we need to be aware of time constraints here, because if we had the conversation, the executive committee, we just loaded them down with some stuff before. Now we're loading it down. We either have to defer one or defer the other, because it's not fair to the executive committee to do that. Either that or you form, as our board would suggest, an ad hoc committee to do the review separate from the work that the executive committee is going to do, which maybe is counterproductive for what the executive committee is supposed to do. But I'm unless we're doing like one policy a month or something, and not the whole package, that is just too much work to do. You already have busy lives.
Mr. Garfin, I see your hand up.
Thanks, Madam Chair. I think, Helen, Claire, and Sue and I went through them the last time. Honestly, I think we did a lot of work on them. I think there's some minor adjustments that may be required on some of them, but I think you'll go through them relatively quickly. To Dr. Ayer's point, yeah, you might have 2 meetings with it, but I suspect either 1 or 2 at the maximum to go through. Some changes have come up over the last 2 years, so I think staff will be able to bring some of the issues forward that should be changed in those policies. But I would say that's a priority that should be done, I think.
Okay, thank you. Helen, Claire?
Thank you, Madam Chair. Through you, and to layer on to my colleagues' comments, it is required. It's actually, the policy review is overdue. It was due at the end of last year, so it's not something that we can just sort of toss off. It is important, and we are seeing a lot of business coming up before this board that if we were all aware of what the policies are, the things coming before the board would be made redundant. And so it is a time saving if we put the time in now and refresh everybody about what the policies are that we currently have in place, in my opinion. Thank you, Madam Chair.
Thank you. Luke, did I see your hand up?
No, I intend to carry on my view. I'm sure
Okay.
won't be a major undertaking. I don't think there's a specific timeline connected to anything in here, so it takes a couple of months. It won't be a major undertaking, I don't think.
Okay. Yeah.
Just with that, just so it doesn't get lost, or I don't think it will, but to put it into context, I'd like to put a motion forward that the board directs the executive committee to review board policies.
Okay, so we have a mover, seconder, Luke? Any other comments or further discussion? I will call the vote. All in favor? That is carried. Thank you.
Oh, my load down. Thanks, buddy.
No, I'm just sitting here quietly.
That doesn't get you out of work, apparently.
I don't know whether you're supposed to abstain or anything because if you're on an executive committee or you're part of what's going on, is it a conflict of interest to be voting on that? And so I'm just asking that question because the rules are different everywhere you go. And I want to make sure that I'm following the process and that we're not getting ourselves in hot water or in trouble down the road.
If there's any conflict between being on the board and on the executive committee. And voting on the same, yeah, I don't see a conflict. I don't think anyone else does. Okay. We are ready to move in camera for item 11, so I need a motion to move in camera. Thank you.